One bill, SB 36. I will turn it over to the Vice Chair. I will be presenting the bill. Oh, we're going to go ahead and establish a quorum first. Would you call the roll, please?
Hernandez?
Here.
Hernandez here. Nguyen? Hall? Mitchell? Monning? Nielsen? Here. Nielsen here. Pan? Here. Pan here. Roth? Here. Roth here. Wolk? Here. Wolk here.
The quorum has been established.
We can short it however you want.
Oh, here.
Good afternoon, Madam Chair. Members, the Assembly amendments bridge the gap between the current Medicaid Section 1115 waiver and the new waiver, which is still being negotiated with the federal government. This bill does two things. First, it allows the Department of Health Care Services to request one or more temporary waiver extensions. Second, it requires the department to extend the existing hospital payment methodologies under the current waiver. The reason for the bill is the current waiver expires October 31st, 2015, and a new waiver agreement has not been reached between the state, and the federal government. At this point in the session, it is unlikely the agreement will be reached before the legislature adjourns today. An extension of the current hospital financing methodology would continue to provide essential funding for safety net hospitals in the event of a delay in completion of the next waiver and until state hospital financing laws is amended to determine the new waiver-related hospital funding provisions resulting for the next waiver. The bill passed the Assembly with bipartisan support. Members, I respectfully ask for an aye vote.
Support. Madam Chair and members, Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. As you know, the waiver provides core funding to the public hospitals so they can continue their mission to serve the poor and the uninsured. It's critical for the state to maintain existing expenditure authority, and it's also really important that this bill be passed because while state law specifies what the waiver allows the state to make payment streams available to public hospitals, state law specifies exactly how those funds are distributed among providers. So without this state authorization, there would be no guidance for how to distribute this money among public hospitals. So we strongly support this measure and urge your aye vote. Thank you.
Madam Chair and members, Michelle Cabrera with SEIU California. We represent public hospital workers in several of our state's public hospitals, which are at the core of our healthcare safety net serving Medi-Cal and uninsured patients. The committee likely also knows that public hospitals are financed in a unique way, and the waiver is a core piece of that. Waivers are negotiated between the state and the federal government, and as such, they can be unpredictable in terms of their timing and resolution, and so we urge your support to ensure that public hospitals continue to be able to be financed through this period of negotiation and urge your support. Thank you.
Barbara Glazer with the California Hospital Association, also here today to urge your support of this very important measure. Thank you.
Catherine Austin Scott on behalf of the District Hospital Leadership Forum in support of this measure.
Kelly Brooks on behalf of the California State Association of Counties here in support.
Amber King with the Association of California Healthcare Districts in support.
Any more support? Any opposition? Committee members?
Bill.
Hi, Holly.
Senator Hall, top of the afternoon to you.
Senator Mitchell.
Just quick, I felt like that we already did a bill in committee on 1115 waiver. Is this a different bill, same bill? Just kind of where?
My understanding, the bill that we did was the waiver, but this is an extension until an agreement is made with the federal government.
Got it. Thank you.
Would you like to close
Ask for an aye vote.
this motion? Motion by Pan. This is SB 36. The motion is that the Assembly amendments to concurred in. Please call for the vote.
Hernandez? Hernandez, aye. Nguyen?
Aye.
Nguyen, aye. Hall?
Aye.
Hall, aye. Mitchell? Aye. Mitchell, aye. Monning?
Aye.
Monning, aye. Nielsen?
Aye.
Nielsen, aye. Pan?
Aye.
Pan, aye. Roth? Roth, aye. Wolk? Wolk, aye.
It passes 9-0. Thank you.
Okay, that concludes the business of the day. We are adjourned. Thank you.